Hello, welcome to Summerfest Online 2020. Thank you very much for coming along to view these presentations. Just a quick reminder that we have a number of exhibitors in the exhibitors hall. If you want to go along and have a quick browse, maybe do some shopping, then we'd love to see you. And a quick reminder too about our wonderful sponsors, Yayo Hemp Products and Butte Island Cheese. They're also in the exhibitors hall and they'd love to see you too. If you've enjoyed the show, please remember this is a free event, and if you'd like to make a small donation, you'd be very welcome. Please go to the Friends of VegFest page to make a donation. And a reminder too, we have another show in November, London Online, and in next March, Plant Powered Expo. And you can find out all about that on VegfestUK. Thanks very much and enjoy the presentation.
Thanks for your attention, and what a great turn up you guys have got here today. I'm so excited to be here. When my mother introduces me, my darling mother introduces me to her friends, she usually says with some parental pride, "Here, this is Andrew, and he's a doctor." And then she goes on to say, "He's actually an intensive care doctor. And you're very lucky to be meeting him here now, rather than if you were a patient in his intensive care unit." And that's a very true thing my darling mum actually says, because you don't want to meet me in my intensive care unit. Because if you're lying in a bed there while I'm treating you, you're pretty seriously ill. In fact, just before I go on and show a photo, how many people have been a patient in an intensive care unit in this room? Are you prepared to put up your hand? All right, just a couple. Okay, so I hope I'm not going to scare you with what I'm going to show you, but it's a sad and lonely and cold, scary place to be a patient. It's actually not that fun to be a doctor sometimes there. And it's a really terrible place for families who get dragged in. They haven't seen each other since last Christmas. Suddenly they're all dragged in from all parts of the world to sit there and realise that one of their family members may die. And they have to deal with that situation, realising that the one that they want to be there with today is actually in a bed. And they're usually in a bed that looks like this. Machines everywhere. And I won't go through and label what all these different machines are, but this is a patient treated in my ICU who's pretty well nearly dead, lying under that pink blanket somewhere, on a bunch of life-supporting machines to basically try and stay alive. And it's really scary and it's really hard. And I think that, well, I want to tell you that unfortunately many of the people that are in this situation don't make it. And I'm sure you're aware of that. About 1 in 8 of the patients I treat will not get out of the ICU alive. Another 1 in 8 will get out of the ICU alive but not get out of the hospital alive. And then about another 1 in 8 won't probably make the next Christmas after their intensive care illness. So by that stage, 3/8 is quite a large number of people that are going to die following their intensive care unit illness. Now, many of them may be actually the ones that survive are often the young people that come off a motorbike and break their leg and get on a ventilator for a short time. So the ones who've got the chronic diseases are much more likely to die. And it truly is a scary place. So what I hope I'll teach you today, or you will learn from just some stories that I want to tell you, is that lifestyle diseases, as we've already heard, are contributing to, in my mind, or even causing what we call critical illness, those patients who need to come to an intensive care unit. And I think, as we'll hear many times today, that a lifestyle based on predominantly eating plants, but also, as Tom mentioned, including things like exercise and mindfulness, will really improve human health. Your own, and for those of you who are doctors in the room, those of your patients. And I want to try to get you thinking. I haven't got a lot of evidence to prove this, but lifestyle modification may well be the single best thing we can do to keep people out of the intensive care unit. And given it's such a terrible place, I don't think you as a person want to come there. And if you're a healthcare practitioner in the room, you probably don't want your patients to go there. And so that's what I want to try to convince you today. Just before I go on, I'm kind of interested to know who we've got in the room. How many people are healthcare practitioners? Can you put up your hand? All right, quite a good number. And how many are non-healthcare practitioners? The rest? All right, so probably more healthcare practitioners than not. And how many are what you would call vegan already? Most of the room. How many are sort of strictly whole foods, plant-based? Probably most of those people again. How many are simply vegetarian? A few. And how many still eat, or not still, consume animals? How many consume animals? A few of you are brave enough to put up your hands. So that just helps me understand how much that I'm probably preaching a little bit to the converted, but I want to at least make you feel happy for the choices that the majority of the room have already made. I want to start by just taking you on a little ward round with me in the intensive care unit. When I was preparing this talk recently, I just thought I'd walk around and have a look and see what my patients actually had at the time. And here's the first one, a 45-year-old man who was admitted with chest pain, very severe pain in the chest, and he's got pneumonia, an infection in the lung. And I looked at his background. He's got diabetes, we've just heard from Tom. He's got ischemic heart disease, that's blocked arteries in the heart, and he's had an acute myocardial infarction, we call it, or a heart attack, as you probably know. He's a smoker still, despite having a heart attack. He's got hypertension, high blood pressure. He's got hypercholesterolemia, obviously high cholesterol. And he's actually admitted to me on the first time I met him that he drinks too much. And he's 45. Now, I hope I wasn't doing this at 45. Certainly wasn't. And I hope that many of you are not inflicted by a lot of these lifestyle diseases. Here's patient number 2, or B, a 68-year-old woman who's just had a cardiac arrest. The heart stopped in her house due to emphysema. She's got scarring of the lungs, predominantly due to smoking. And she's had a cardiac arrest. She's also been an alcoholic in the past. Good on her for giving that up. She's stopped drinking. But she's got diabetes. She's got ischemic heart disease as well. She's had a stroke, a blood clot to the brain, or a patch of the brain that's not getting blood oxygen. And she smokes too, despite having emphysema that's nearly killing her. And now it nearly has killed her. And she's lying in the ICU trying to do her best to wake up and see whether she's going to survive. Patient C is a 62-year-old man who's got severe sepsis. Sepsis is an infection that involves your whole body, and he's got that from MRSA, methicillin-resistant Staphylococcus aureus, which you might know if you're not a healthcare practitioner as golden staph, as the lay media likes to call it. This person also has hypertension, ischemic heart disease, had a stent previously, hypercholesterolemia, and renal failure, kidney failure, and is on long-term dialysis. So I won't take you through any more of them. There's just 3 of them who are very seriously inflicted with chronic lifestyle diseases. And so I looked at the whole rest of the ward just in summary. 5 of them had infections on the background of severe chronic lifestyle diseases. And I wonder if the infections are partly due, or the fact the infections made them so sick to need intensive care may well be because of these severe chronic lifestyle diseases. 3 had an acute problem due to a well-understood suboptimal lifestyle choice, smoking. We just saw from Tom that it's still one of the most serious health inflictors that we do in our society. And 3 people in my ICU were still smoking and now are in ICU because of it. And we're not going to focus on smoking today, but as many understand, it's often connected with what we eat and what we do in our lives. One of the patients had surgery just now and arrived in the ICU for the very first time after just having a bowel cancer removed. And they also had the bowel cancer, or the cancer had gone to the liver. And so this person has got a disease which we now know is likely a lifestyle disorder as well. One had non-compliance to medications for epilepsy, so not taking their drug. And I guess that's not truly a lifestyle disease, but it's a lifestyle choice, I guess, when he's had it for 40 years and he doesn't continue to take his medications. And one of them had an intentional drug overdose due to suicidal ideation. And whether you call that lifestyle or not, I guess we can debate. But putting it together, 11 of the patients, 100% of them had at least one chronic lifestyle disorder, and the average was 3. 9 of the 11 had likely lifestyle-related acute problems right now, and 8 of the 11 were actually considered obese when you measure their body mass index and use the scales that are reported in the literature, that over 30 as a BMI, body mass index, is considered obese. And nearly all my patients are obese. So I posit to you that these patients that are coming to ICU are partly getting it because of their lifestyle disorders. The ones that don't have these lifestyle problems probably are the ones that come and go quickly. And I don't see as many of them as I see these sort of patients. Now, I also want to share with you that for me, the ICU has been a stressful place for myself. I want to tell you a little bit of a story about my personal situation, because I've been working now in ICU for 25 years actually, and it's a demanding work environment with lots of things happening. I also am an academic researcher, so I do research on some of the interventions we prescribe and give to our intensive care patients, and I became involved with a big group of researchers that were publishing big studies and giving talks all around the world and basically trying to do two jobs in the same time zone, in the same time slot, if you like. And it ended up not being so good for me. And this is a photo from just about 6 years ago when actually I was on sabbatical leave from my hospital in Melbourne. I was over here in Switzerland, in Europe. I was in Switzerland visiting a professor to learn more about what my research interest was, which is nutrition for the ICU patient, what we actually feed the patient while they're in the intensive care. And you can probably see there I look a bit chubby. I'm disconnected with my kids that are in the back of the photo. My wife asked me to smile for the photo. It's probably the only smile I put on that day. You can see I've got 2 bottles of alcohol hanging off the hands. We're going to visit my mentor, the person I'm there to do the sabbatical with. And I guess the other thing I want to show you, and not everyone will be able to see, but I had this sore on my chin that I was just picking. That sore lasted for 18 months because I think I was just totally stressed by the workload and the pressures that I had come under. And I wonder how many of you listen to the Rich Roll podcast, which is a guy that I really helped turn my life around. Rich Roll's a vegan ultra athlete, and he interviewed a chap called John Gordon, who's an author, and gave this quote last year. We don't get burned out because of what we do. We get burned out because we forget why we do it. And that really speaks to me because I'd stopped really understanding why I was doing what I was doing. I had started to become a yes man to everyone, a people pleaser, an achievement addict. I don't know what you want to call it, but if somebody asked me to do another research study, sure, I'll do it. Someone said, come and give a talk somewhere in the world, sure, I'll do it, especially if it was overseas. If someone said, go on some committee, yeah, I'll do it. You want to chair the committee? Yeah, I'll do it. And the load just built up. And for me, that wasn't a good thing. And to cut a long story, well, one more thing I wanted to show you is that I think if life is supposed to be about mind, body and soul, my life had actually truly become about work. And I wonder how many in this room sometimes feel that work is overwhelming for them and that makes them have some struggles in their life. And so I got myself into a bad situation, and under this stress, I started to self-soothe. I don't want to go into all the personal details because it is a bit personal, but the behaviour that I started actually really became it made my career difficult and also made my home life and my family life and threatened my marriage actually. And so I had to really think hard about things, and I had to resign from work abruptly and spend some time figuring out what I was going to do. And I spent a year off work basically reading everything I could in psychologists' offices, in lawyers' offices. It was complicated, and I did a lot of reading about self-development. I came up with multiple sources, led me to understand what many of you probably already do understand, that life's about 3 things that we do basically. Looking after ourselves so that we can combine with other groups of people in communities so that we can do good for the world, contribute, serve, as Tom said earlier today. And so these 3 buckets, balls, whatever you want to call them, are so vital. And I had not been doing the top one, nurturing myself, at all. Just didn't seem important, as I was doing my great contribution to humanity by writing another paper that got me another thing on my CV. And so I guess I learned pretty quickly that I needed to make some changes. And this is where the food comes in, because my nurturing myself quite rapidly, all these things came to me from the simple things that were happening in my life and what I was reading, that all I needed to do was eat more healthily, get into mindfulness and really understand it, start exercising well again. I had been an exerciser and I needed to get back into it, and to invest in the relationships that I wasn't doing. And I want to tell you a little bit about that briefly today before I finish on the food. So food was the first thing I started with, and I actually thought I ate pretty well, healthily. I didn't eat a lot of meat, but I did eat red meat. And, I kind of loved my porridge in the morning, and, I thought it was a good diet. But once I started reading properly, of course it wasn't the most healthful diet. And, eventually I had to change. I also decided to pursue some mindfulness meditation based on a whole lot of things that came at me at once, including a psychologist who suggested it, and my wife who started to do it, and other people that were talking about it. And I'm not going to spend much time on mindfulness other than to say that it just seems to be such a powerful practice that has helped me and must go with the things that we're talking about today with food. I also got back into exercise. I'd been a runner all my life, and I'd done some marathons about 15 years ago, but then given it up. It's just sort of stopped and got into a sedentary lifestyle where all I did was sit on the computer, type the next paper, or go and see patients. They were my two things. Sit at the desk, go and see patients. Sit at the desk, go and see patients. And as I stopped doing the exercise that I needed, my back got sore, I got all the bad posture, I put on weight, and it was only when I reinvigorated my running career that things started getting good again. And this is just a year ago when I did a 60-kilometre race, and I don't want to show that off other than to show my daughters who decided to run the last couple of 100 metres with me, excited to be there with me, and me actually smiling despite having just run 60 kilometres over 6 hours. And so I'd like to say that the combination of these things has hopefully made me a much healthier me. These are the 6-year or 5-year difference photos. Hopefully you can see that I lost a bit of weight, I look healthier, I feel younger, and now my life seems so much better because of the lifestyle choices I've made personally. And so I recover from my sporting activity so much better, I sleep better, I feel better. I'm sure all of you who are already plant-based understand the feelings and the benefits we get out of doing that. But it's not about me, that's not what we're here to talk about today. We're here really to talk about how we can get plants or vegetable strong diet or whatever you want to call it as an intervention that we give to our patients. If you're a healthcare practitioner or if you are a person, how you can continue to eat this way for your health benefits. And for me, I learned about this plant-based nutrition business because my aunt, my wife's aunt actually, she's not a relation, but my wife's aunt got this book given to her by a wonderful GP. How many GPs in the room? Fantastic. I hope you already know about this book because she's 80 years old when she gets this book. She's got angina, chest pain that she's getting recurrently. She's getting 3 attacks a day, and she's told by a cardiologist, he's a good cardiologist, he's a friend of mine, he says, you've had 8 stents, you're on all the drugs you can be on, there's nothing else I can do, just enjoy the rest of your life. And she's got 3 attacks a day of angina. Her GP is a smart guy, and he finds this book and gives it to her and says, why don't you have a look at this? And she shows it to me, and I said, never heard of it. What a load of rubbish. Who could prevent and reverse heart disease? And as those of you who know, Dr Esselstyn's done some amazing work trying to change his patients' lives by putting them on a very strict whole foods plant-based diet. No oil, no avocado, no limited nuts. And it sounds pretty harsh. So when she gave it to me, I said, rabbit food. I'm not going to eat that. Good luck. Ring me if it works. 6 months later, she rang me and she said, Andrew, guess what? I haven't had an attack of angina for 5 months. 6 months after she'd stopped. She said, I only got 2 more attacks, and they happened like 2 or 3 days after she changed her diet. She went from 3 a day to none. She's never had an attack since. She's back on her bike at 84, 85 now, and she's fantastic. So I thought, I've got to take this seriously. And so, of course, I started reading, and I came across this documentary, which hopefully all of you have seen in the room. Has anyone not seen Forks Over Knives? Go and watch it, because you might have the same reaction as me and my wife, sitting there on Netflix or however we watched it in bed one night, and we looked at each other as the credits are rolling and thought, we've got to do this. We've got to give up meat. And it wasn't easy, it wasn't quick. We went straight to pescatarian, we ate a bit of fish for a while. Gradually we gave up the fish, gradually we gave up the dairy, and now 3 years now that I've been fully plant-based and loving it. This is a sort of Christmas that we have now in our family. This was our Christmas the year before last when my wife put on a massive spread of all these things up, totally whole food, plant-based. And my whole family, the rest of them who eat meat, came along and they actually loved every bit of it. And most of them went home saying, God, that was healthy. And God, I enjoyed it. We're into smoothies, green smoothies. I have one of these, so it doesn't project very well when it's that dark green, but I have one of those most days, and I find that's just the easiest way for those people who aren't plant-based to start it off. Just go and drink a green smoothie. Put a bit of fruit into it to give it a bit of sweetness. And my research interest now is to try to get these into our hospitalised patients. I want to get patients drinking these every day so that they can start to understand what a plant-based diet is and actually get the benefits, which I think you might even get in a week in hospital of drinking these things. I'm trying to get some research funding and protocol together now to actually deliver these into our intensive care unit patients while they've got a nasogastric tube down into their stomach. Now, of course, as we're going to hear all today, and you've heard already from Tom, there are a bunch of diseases that are well known now to be benefited or to have benefits from having a whole foods plant-based diet. And if you don't know this book, How Not to Die, written by Michael Greger, who produces the website Nutrition Facts that Tom mentioned, go and buy it, read it. You can get it on iBooks, you can get it in the shop, and it goes through all the diseases that you can help with a whole foods plant-based diet. So I don't want to spend a lot of time on it. I only want to show you one study to finish off. And this is the study in The Lancet in 1990 by Dean Ornish and his team. And many of you probably have heard of this study too. 1990 was actually the first year I was a doctor. We call it intern in Australia. I think in UK you call it house officer. So I was an intern, being a doctor, learning about heart disease. And what I was told was we had aspirin and we had a drug we don't even use much now called TPA, thrombolysis. We used to clot bust the heart attacks. And we'd put people, that's about all we could do for heart attacks. We'd put them in coronary care. We'd give them bacon and eggs for breakfast. And we'd basically, that was what I was understood. I was quite interested in cardiology. For a moment there I was going to be a cardiologist. I thought it was a fun disease. Nobody told me about this paper. Nobody even mentioned it, that I might be able to, as a doctor, reverse coronary heart disease rather than just treat it. In this study, if you're not familiar with it, Dr. Ornish took one group of patients and he randomised them to two groups. So I'm a bit of a randomised controlled trial junkie as an academic. I think these are the piece de resistance that make us believe in interventions that they work. So he took this group of patients, he randomised them. This is what they had. They had 1 to 3 vessel heart disease. There's only 3 main coronary arteries, so they either had mild, moderate or severe coronary heart disease, but they had to have it. And he randomised them to an intervention which was 4-pronged. It was a low-fat vegetarian diet with no animal products except for a little bit of egg white, I think they'll have 1 or 2 egg whites a day, and low-fat yogurt. And they had no caloric restriction. They could eat whatever they wanted, as much as they liked. The second thing was moderate aerobic exercise, 3 hours a week at target heart rate zones that they worked out for them. So that's like, half an hour, 6 days a week, or 40 minutes, 5 days a week. Not that much, but still exercise. They did stress management training, 1 hour a day. He called it stretching, but really it was yoga, as many of us know. I don't think the journal would have accepted it if he said yoga. And it was also meditation and also visualization, using imagery to help make us understand what we're doing. And the last thing was group support. By bringing everybody together twice a week to sit in a community and discuss the hows and whys and how the hurdles that they were dealing with as they tried this lifestyle, that was what he was trying to do with this community. So one group got that package, the other group just went on and did what they normally did. And I think this is very, very valuable, this study, because first of all, let's just look at their cholesterol levels. And here is the change in cholesterol levels in millimoles per litre. Do you use mostly millimoles per litre in England, in UK? Because this is the change in the red is the control group. The ones who didn't change their lifestyle, their cholesterol actually got a bit better. Just a small fraction dropped, maybe 0.3 on the total cholesterol and 0.25 or something in the LDL cholesterol. So if you were 5, you went down to 4.7. That's okay. And we'd be happy with that. And these people were in a study, so they probably took their diet a little bit seriously. But look at the lifestyle intervention. They dropped their cholesterol by 1.4 or their LDL cholesterol by nearly 1.5. So you're talking 5 down to 3.5. This is the sort of power that you can get by doing this whole intervention. And better still, as Tom's already alluded to, coronary heart disease or atherosclerosis was improved by using this intervention. The narrowings of the arteries are measured in a percentage usually. We talk about, say, 40% blocked or 60% blocked or 80%. And whatever they were at the start, the zero line, the control group continued to progress their blockage. So at 1 year, they've gone 3.5% worse. So if they were 40%, they're now 43.5%. At 5 years, they were up to more than 10% worse. 40's gone up to 50. But the lifestyle group actually came less. They had lesser blockages in their arteries. And so you can see here that at 1 year it was down to just over 2%. Now that doesn't sound much, but it's in the different direction. So their artery disease is reversing. And they even got benefits that went out to 5 years, despite this study only going for 6 months. So this is a massive difference and something that we need to take very seriously. And to me as a doctor in 1990, and even now, I don't know one single drug that does this. Some people argue that the cholesterol drugs might do this, but I don't think they do. This is a lifestyle intervention that can truly make people's heart disease go away. And Tom's already showed this slide. This is borrowed from Dr. Esselstyn, who speaks about this, and I think it's exactly the same slide that Tom showed. This is a doctor friend, a doctor colleague of Dr. Esselstyn's, actually. I think he's a pulmonologist in the US who'd had a heart attack. And he had quite narrowing, as Tom's taken us through, of the distal left anterior descending, one of the main arteries of the heart. And he only went on a plant-based diet, no drugs, no stents, no other things. And 2.5 years later, he's got nearly a completely clear coronary artery. It's an anecdote. It's a very powerful anecdote. But this helps tell us that we can actually make a difference to these patients with an intervention that's based on lifestyle. Now, to finish off, why have I highlighted this Ornish study? Well, number one, I told you randomised controlled trials mean a lot to me. I think that's going to change practice. And there aren't a lot of randomised controlled trials in the plant-based nutrition world, I'll be honest. There's lots of big cohort studies, but there aren't many randomised controlled studies. And this is a smallish study, I'll be honest. There's only about 30 patients in each group. But this was quite a hard study to do, and so it's hard to imagine that you can get huge numbers to do studies like this. And so I highlight it because I think that the whole foods plant-based diet is kind of like winning the silver medal. Let's say if you're on a standard UK diet or a standard Australian diet or a standard American diet, you don't even make the Olympics, right? But if you eat a bit of chicken because it's better than red meat and just cut your red meat down a little bit, you might have made the Olympics. If you're vegetarian, you probably make the final of the Olympics. But you don't win the silver medal till you get on your whole foods plant-based diet. But to get the gold, it's also adding lifestyle. And if there's one point I want to make today to most of you who are already eating plant-based diet, consider doing the other lifestyle factors even better than you are. Meditation, exercise, and community support. Community support might be actually the least talked about and the most important thing we can do. Bringing groups together like this where we can talk, having forums on Facebook or wherever so that we can understand each other's problems and hurdles are going to make it easier for us to make the changes in our lives. And it's truly actually about love. Love for ourselves by putting the best food into ourselves. Love for the planet by caring about the animals and caring about the environment. And just general love for the world. I think that's what it's all about. And it's so corny perhaps to come up with an acronym for what love means. But they are the 4 interventions. Look within, organised support, vegetable strong diet, and exercise regularly. So, to finish off, I truly think to not become a patient in the intensive care unit yourself, or to not put patients in the ICU as a doctor, we need to try to get people to be eating whole food plant-based foods as much as possible, having them have a regular movement program, be truly proactively mindful. Meditation works for me, but there are many other mindfulness practices, and to build loving connections wherever we can. Thanks so much for your time, and particularly thanks to Tom and Shireen for organising a great meeting. Thank you.